I'm just pressing this. Yes. Okay. Good luck.
All right. I want to thank you for inviting me to talk about the Nurse-Family Partnership Program. I'm excited to talk about this program because it is a beautiful representation of the power of nurses in nursing. Okay. Today, I'll introduce key components of the Nurse-Family Partnership Program and discuss social determinants of health within the context of the Nurse-Family Partnership Program and how we in Philadelphia continue to remain client-centered and focused on the needs of our population. So Nurse-Family Partnership is an evidence-based model. It's with over 40 years of evidence and counting. It maintains a close relationship with its founder, Dr. David Olds, and the Prevention Research Center of Family and Child Health at the University of Colorado. Although the program operates independent of the research center, the center does continue to measure the program's long-term effects and publishes that information, and also continues to lead research to improve the program model. So the program was tested in 3 separate randomized control trials, each with a different population, starting in 1977 in Elmira, New York, then in Memphis, Tennessee, and then in Denver, Colorado. So some of the trial outcomes included a reduction in child abuse and neglect, a reduction in ER visits and childhood injuries, improvements in child language development, cognition, healthier pregnancies, and many other cost-saving benefits to society, the government, and of course, individual families. So Dr. Ted Miller of the Pacific Institute of Research and Evaluation predicted that in Pennsylvania, by the time a child turns 18 years old, the program outcomes would have saved $6.80 for every dollar invested. So since replication began in 1996, the Nurse-Family Partnership has served nationally over 300,000 families. We're currently in 41 states, including the U.S. Virgin Islands and some tribal communities. The estimated return on investment outside of Pennsylvania is about $5.70 for the highest risk families served. So how exactly does this program happen? Well, specially trained nurses partner with first-time moms and begin visiting moms during pregnancy and continue visiting moms until their child turns 2 years old. The median income for families in Philadelphia at intake is about $7,500, and half of our families report earning less than that. So families who are enrolled in the program are well below the federal poverty level. So nurses in our program are specially trained in pregnancy, early development, and the very unique model and curriculum of the Nurse-Family Partnership Program. And they're able to provide just careful assessment, education, and coaching to moms. Beginning a relationship in pregnancy is just so timely. We know that pregnancy outcomes are heavily influenced by prenatal care and a mother's ability to understand and advocate for her own health. Our nurses are able to identify pregnancy complications early, as well as postpartum complications, and once a child is born, developmental delays, therefore leading to improved child health outcomes. We also know that a parent's interactions with their child in the first 2 years of life plays a monumental role in shaping brain development. Our nurses are able to also help prevent and alleviate the impact of trauma and adverse childhood experiences. So what are the logistics? Nurses carry a caseload of about 25 clients. Visits typically last anywhere from 60 to 90 minutes, but they can be less. After all, our program is client-driven, so the timing, the frequency, the content, the location, and even who's present at the visit is mutually decided upon between the nurse and the family. So our goals are simply to improve pregnancy outcomes, improve child development, and improve the economic self-sufficiency of the family. So although I can state those goals simply, it's far more challenging to verbalize the social, environmental, and systematic challenges that both our nurses and families must navigate to reach those outcomes. That's why the skill of a nurse is so important, as well as the trust that they're able to garner early in the relationship with a mother. You see, our nurses, they don't just focus on health, they care holistically for the mom and the family. Nurses spend their time as part of the program model working in these 6 areas: maternal, child, environmental, and family health, child development, life course development, and the utilization of health and human services. This approach aligns closely with assessing and addressing the social determinants of health. Our work is most powerful when tied closely with community resources and integrated with other providers. However, this is not without its challenges, because we know that maintaining relationships and following up takes time and effort on all parties. So, and I think, nurse-family partnership nurses do identify with this challenge, and they're extremely motivated to ensure equal and fair access for all the families that they serve. So an assessment tool utilized by our nurses to further break down the 6 areas just mentioned is the Strength and Risk, or STAR, framework. The bulleted items under the 4 main social determinants of health, those are just 14 of the 21 STAR measurement categories utilized by our nurses to plan and prioritize interventions based on a mother's greatest area of risk. So clearly, as you can see, addressing the social determinants of health is a big part of how we get to those improved outcomes of improved health, economic self-sufficiency. So although we have our own assessments and our own observations, we also often seek to hear directly from our clients what they identify as challenges. Again, this is a partnership, so it's important for us to always reference what our clients feel are priorities. So on a self-reported survey, our clients identified employment and housing as the top stressors or concerns. Living in Philadelphia, in one of the poorest cities in the nation with some of the poorest health outcomes, it's not surprising that employment, housing, and education are at the top of this list. Our families want stable employment and housing, but oftentimes systematic barriers like racism, access to care, access to quality education for themselves and their children, and long-standing outdated policies do stand in their way. So in Philadelphia, we've integrated several programs to help meet the needs of our clients and try to address some of those systematic barriers. We introduced the Mabel Morris Family Home Visit Program, which also employs full-time nurses. The nurses in that program utilize the Parents as Teachers home visiting curriculum to engage with families until their children have successfully transitioned into a quality kindergarten program. Our nursing legal partnership has 2 full-time legal aid attorneys on site, and they've been able to address a wide range of social and legal issues. And most of those legal issues are related to income, housing, and benefits. Through the support of our nursing legal partnership, our nurses have also been able to strengthen their voices, becoming active participants or leaders in several coalitions which have achieved high-profile policy reform in Philadelphia, including Policy 234 for pregnant parenting and married students. This policy states that the school district shall ensure equal access and full participation of all students, pregnant and parenting students, and make accommodations for mothers seeking to breast pump during school hours, which leads me to our lactation counselors. Recognizing the importance of breastfeeding to maternal child health outcomes, our program extended breastfeeding education to all staff, as well as supported some staff financially through grant funding to obtain advanced certification in lactation consultation. These initiatives have successfully increased our breastfeeding initiation rates and duration rates, and help us to identify important breastfeeding policies and practices within our organization. We also Also important to highlight is the official establishment of our Community Advisory Council, which engages other community organizations to strengthen relationships and learn from each other. Right now, we actively engage with over 20 organizations, from domestic violence to primary care to shelters, and even other home visiting programs. So what are some of the statistics in Philadelphia? 5,000, since 2001, 5,000 families. We've served 5,000 families. Cumulatively, 90% of our mothers initiate breastfeeding. 96% of nurse family partnership children are up to date on their immunizations. 40% of the families enrolled in our Mabel Morris program are nurse family partnership graduates, and 26% of the children served by the Mabel Morris program have a disability. Once again, highlighting the benefit of having a skilled nurse in the home partnering with a family. Over 400 of our clients have received legal services through our nursing legal partnership in the 2 years since its inception in 2016, and 82% of those clients receiving legal services agree that those services decrease their stress level, making the job of the nurse a little bit more easier. So I'll start to finish up this presentation by beginning with a quote from one of our amazing nurse home visitors, Noelia Blanco, that said, "The day in the life of an NFP nurse is amazing. Our clients place their trust in us, and we plant seeds for success. Many times it's a bumpy road full of surprises and at times heartaches, but with their nurse, they don't have to go through it alone. Frequently, we see wonderful accomplishments by the end of 2 years, and at times we see it years later." So a nurse family partnership nurse can be navigating their streets of Philadelphia on their way to a home visit. They could be assessing the community for resources. They could be meeting with a family at a nearby park or playground or wherever is convenient for the family. They could be supporting policy and advocacy efforts or preparing or giving testimony in front of City Council. They could be giving a presentation or at an event, building community and making connections. Nurses are versatile, and to understand the populations they serve, it's important for them to be immersed and a part of the community to help address some of those social determinants of health. So we can change the future for the most vulnerable babies born into poverty by equipping the best person for the job, a parent, to be a competent, confident caregiver. In just 2.5 years, we have the ability to deliver a self-assured, capable first-time mom and a thriving child poised for a bright future, all because we meet clients where they are, in their homes, in their communities, at their level, and at their pace. Nurses that do this work not only need a strong educational foundation focused on addressing the complex social needs of individuals, they also need ongoing emotional support in a trauma-informed environment. And a competitive salary definitely helps. At the end of the day, nurse family partnership nurses are public health nurses practicing at the top of their license. And this work requires a high level of critical thinking in an extremely autonomous environment. Wait a minute. So again, I want to thank you for this opportunity on behalf of my colleagues and all the families we serve in Philadelphia, and we want to extend an invitation to all committee members. You're welcome to visit our site. We love visitors. We love to share our passionate commitment to improving health outcomes. And I've also included, I promise I have. Nope, it's not working this time. No? Well, I promise at the end of this slideshow, there is a link to our website, so you can learn more about our programs. And I've also included a link to a public health video promoting public health nursing. I encourage you to share that video far and wide because public health nursing, there it goes, is the future of nursing. Thank you.